Hi, I'm Dr. Diana Londoño. I'm a board certified holistic urologist and a general urologist. And you've got to stop scrolling and listen to this because this is truly going to change your life. So, today I want to talk about pleasure and pain. And so much of life, it really is about both. It doesn't matter if we're talking about your wedding, your divorce, having surgery, having a baby, eating something that you like. Everything in life truly is going to likely have a little bit of both. And that's okay. And the thing is, we can have two or more emotions at once because we're human and we're multidimensional. And as a urologist, I see that actually emotions play a huge part in our wellness or our disease. And we may just think that, they don't have any role in our health, but they are hugely going to affect your health. And so I want to talk about that today because a lot of the things I see as a general urologist, seeing both men and women, is I see something called pelvic floor dysfunction. And it can manifest differently if you're a man or a woman. So I'm going to start with the women first because also the anatomy is different. So what that means is that the pelvic floor, it literally is like a hammock, like a bowl of muscles that is holding up your bladder, your vagina, your rectum. And what can happen with emotions is that when the stress emotions are definitely trauma that is usually stored in our hips, when those emotions get stuck and they don't move through our body and they get stuck in those areas, those muscles tense up really, a lot. And it's sort of the same idea as if you type a lot or you're sort of stressed and you feel in your neck the tension and you need to get a massage because it's so tight and tense. So sometimes we're able to feel NOS or just feel the tension in our back or neck, but we may not be able to feel internally what's happening. But it doesn't mean that things are not going to show up with some symptoms. So for many women, it can be pain. It can be in the vagina. It can be down in the bladder area. It can feel like a lot of, frequency or urgency to pee. It can just feel inflamed. It can feel like it's not right. And you could also have, pain with penetration or pain during any intercourse. So it can manifest in a lot of ways. And as a urologist, obviously, if we're having, frequency and urgency to pee, there could be many reasons, but one of them can definitely be or made worse by those pelvic floor muscles being very tight. So a lot of the things that I do for my patients after, I examine them and I feel the areas internal in the vagina that are tight, and you can feel them yourself as a patient when I examine you, is that we then have to definitely address the emotions, the stress, the worry that is causing this. And then I send usually to physical therapy, or I usually also give like an intravaginal in your vagina or rectum muscle relaxant to help. But the other really, really good tool that I have now is a vibratory tool, which I offer to patients when they, are doing their physical therapy, or maybe if they're unable to do physical therapy, this is something they can do for themselves at home in between therapy sessions, after therapy sessions, or again, if they don't go to therapy, this is a great option. So I like this product from Mr. Vibe, and this is the Crescendo 2. And this is a vibratory tool that is very flexible. It can move in different directions. And it has these little buttons for speed and for different settings, because this is really an amazing product that you can customize the settings that you want for vibration. And it has vibration all along it. So basically, you can insert this vaginally, and then you can double it over, and then this can also help in the clitoral area. Now, the good thing about these products is it can be used for pain or pleasure. So that's really why I brought it up initially. Because initially, when there's pain, we want to do the physical therapy, we want to do the muscle relaxants, but then we want to use this ourselves internally to really target and really massage the areas inside and the muscles. That's how you're able to reach them and really help with the pain. So, once the pain cycle, is gone, then this is really a great product for pleasure, for self-pleasure or for pleasure with a partner. And it can also be adjusted and programmed on your app on the phone, so you or your partner can actually do it, during intimacy. So I really, really do love this because it has many functions. Again, you can insert it and then use it in the clitoral area. You can just use it solo, again, to target pain or to target for pleasure. So this is a Crescendo 2, which I absolutely love. I think my patients have really also been very appreciative. It's nice material. It is not like sticky. It's easy to wash. It does not have a smell. You can use it with lubricants. You can use it alone, but it's just really soft. It is about a 2 finger breadth width, so it can be very comfortable for women in all ages or all stages. So I really do love this product. And the other one that I give for my men is the Tenuta 2. So this is a little bit different because we're going to definitely talk about pain and pleasure in men as well. So for the pain aspect, men have the same hammock of muscles now as holding their bladder and prostate area. And for men, it can manifest differently. They may come in with low abdominal pain, like around their bladder, just pressure, sometimes pain in the penis, pain in the testicles, or pain in the perineum, which is the area between your rectum and the scrotum. So like really where you sit when you are riding the bike. So the pain can manifest there, as well as having frequency and urgency to pee. So, people think this is an infection and there's other things or prostatitis. And, if it's not a bacterial infection, then the next usual option or thing we think about is also, again, these pelvic floor muscles being very tight. And it can happen for the same reasons of stress, of worry, of all these emotions getting stuck there. So for men, I also do an exam. This one is rectally, and I will insert my finger, not checking for prostate per se, but really feeling the muscles as well. And you can feel the areas in the exam that is tight. It really feels like, a cord of the muscle, just like we have here in neck, that is tight, and it will be painful. So I do the same treatments for physical therapy, for dealing with emotions, for a suppository that can relax the muscles, warm baths as well for men and women can be very, very helpful as well. Anything that helps you, move, release the stress, any movement is very helpful, or any hobby that you like. But this also can be very helpful. And again, this has a dual purpose because this area sits in the perineum, just kind of like if you kind of like sit on a bike, and then the penis goes here through this ring. And what this happens is it will vibrate, not only going to give relief of pain, but definitely pleasure for a man and keep a nice erection for a man, but also the partner will also get pleasure because they'll be close to it. It'll be vibrating here and here. So these are really, really good tools that are part of things that I offer patients. Again, really help whether we're in the pain or pleasure. And again, these have, just a really long longevity. They're easy to carry, they're easy to clean, and, they're very comfortable. And, I do like that there's so many settings that are already available on the app, or you can customize as well as the speed and things like that. So you can really play with it, and it doesn't have to be monotonous, just, 2 settings, 2 speeds, and really you can have fun with it and play with it. But if you're having pain or discomfort, it can really, really help you get there faster. So if you don't know about them yet, Mystery Vibe is a company. These are 2 of the products, but they have a lot of different products that really can help. So check them out, or check out my profile, or message me. And I hope that you don't, stay in the pain. If you're having pain, that you reach out to a board-certified urologist or any other physician that is comfortable with helping you with these tools or other ideas to really help you get better. So don't lose hope. There is always a solution. We're really here to help you. And just reach out. And I just wish you the best. And remember, life is both pleasure and pain.